All right, welcome back from the break, and I'm going to ask our panelists to come up on stage. And there are a lot of really thoughtful questions here, and fortunately we've got a fair amount of time. I don't know how many we're going to get to, but you guys really did your job to provide these great questions. And just to let you know, I have my phone up here to monitor the time. Oh, there is the time, so I don't have to look like I'm looking at my phone. Good, that's better. All right, well, thank you, everyone, for coming back, and thank you again to our panelists. I actually used the prerogative of having the mic to let them know I was gonna ask the first question, which isn't fair because I can talk to these people all the time, but. One persistently difficult issue that we are faced with in the work that we do at the Moore Center is concerns that if we ask young people, children and young people about their sexual behavior, that we are harming the child, that the child will be harmed by being asked to respond to those questions. And as Rajmi and others have mentioned, a core element of the public health approach to violence prevention is that we rigorously evaluate the effects of our prevention programming. If you don't evaluate, you might have a program that works, you might have a program that doesn't work, and you could even have a program that causes harm. We've done research on policies that cause harm that were intended to help. But if we can't ask kids about their sexual behavior, then we're not going to know if a sexual behavior intervention like Help Wanted works. And then the corollary concern is if you do ask these questions and a child or a young person says they're engaging in harmful behavior, don't you have to report it? And of course, there the concern is if you're a research participant, is it reasonable that a consequence of your participation is that you get reported to the authorities? And that's a separate moral issue. So I wanted to pose those sort of related questions to our panelists and just begin to have a discussion. And I think we're going to have many more discussions here at Hopkins and elsewhere about how do we handle these issues in a way that we can move forward toward validating prevention interventions. So I'll just open it up and you guys can respond.
So I don't have a good answer. Just out of the gate. No, I certainly understand the concern because we want to protect children, right? So I understand the concern. However, what are the costs or the risks of not asking these questions, right? In order to address a problem, we have to understand a problem. So if we can't ask the critical questions, and difficult questions, they are difficult questions. But if we can't ask these critical questions, can we understand fully the problem, the scope of the problem, and then is the work that we're doing effective in addressing that problem? So, I do understand the concern about this, but it does have a chilling effect on researching this topic, and so I think it's something that needs to be further explored, certainly.
I think one of the thoughts I would have is, how do we come at that question in a bit more of a solution-focused way? In working, let me give you an anecdote. In working with juvenile sex offenders, I worked with a young person a few years ago who had committed sexual offences within his family. He also had quite a budding career as what could be he was very good at swimming. So there's some real possibility that could become an important part of his life as an athlete. The immediate thing that was done in that particular situation was social work and law enforcement said, well, you can't go swimming anymore because there's too much risk.
Yeah.
And our position on it was what needs to be in place to allow you to do this in a safe way. So I think to apply that kind of thinking to this kind of problem, what needs to be in place for this kind of research question to be ethical, I think is really important, bearing in mind there are enormous risks if we don't ask these questions. So, there may be various things that we could build in there, like, what is the signposting to other services that may be able to provide support to individuals who are disclosing kind of concerning behaviours? Do you provide levels of anonymity with respect to what's being asked here? There are a number of kind of checks and balances that could be provided that then allows this to be done in a more ethical way. And it's trying to kind of shift the conversation into a kind of more solution-focused paradigm. I think that's important.
Yeah, and I would echo both of what our other panelists have said. I think the support component of it is critical. And while the first priority obviously needs to be do no harm, inaction comes with its own cost as well. When we set out to do the youth campaign, we kept looking for it to have already been done. And what we kept coming back around to was saying we just need to take a step forward in understanding it better. And we can take a small step and incrementally learn more, and really lean on our partners to help with that understanding. Because one of the things for us is we are not clinicians at Thorn, and we recognize that, and we do not try and overstep in that space. But through partnerships, we're able to better understand the issues, some of the correlate issues, and how to go about responsibly engaging with kids. One of the best things that we found is working with organizations like the National Center for the Sexual Behavior of Youth, who have supported groups with kids, and being able to bounce ideas off of them, but then also know that there might be a forum there where we can have some conversations in a supported way rather than it being unsupported for participants.
Thank you. Okay, so moving on now to some of the questions from the audience. One question is, how can we increase public buy-in to sexual abuse prevention rather than punitive mindsets?
Well, so there have been some surveys of the general public about their support for child sexual abuse prevention. And in one recent one, it was somewhere around like 89 or 90% of the respondents said that they believed child sexual abuse prevention was possible, that child sexual abuse could be prevented. But I think the gap is, what does prevention look like? And so I think part of the messaging around that prevention is possible is by explaining what prevention is, what prevention looks like. I think our sort of knee-jerk, as a general public, our knee-jerk kind of response to what is prevention might be victim-focused prevention, where we teach kids to recognize, resist, or respond to or report abusive behavior. And perpetrator prevention or bystander prevention initiatives are sort of not part of that conversation. So I think one of the ways to bridge that gap is to think about how we message prevention and what examples we use, and to really talk about those things that we know have could have an impact through bystander intervention or through perpetrator prevention, so to give the general public tangible examples of prevention.
I'd agree with all of that. I think one of the things that makes it difficult in relation to public buy-in is a kind of othering of sex offenders that takes place. An assumption that individuals who commit sexual offences are wholly different from other human beings. And indeed, actually, some of the research into kind of attitudes and values towards sex offenders suggests that people who have contact with sex offenders in their lives often have a different view of sex offenders from the other people in society, partly because actually they perhaps don't have the same kind of automatic assumption that the media stereotype that all sex offenders are predatory serial pedophiles is necessarily correct. If your uncle has committed a sexual offense, or if you work with sex offenders on a day-to-day basis, you may have a very different view of what sex offenders are. So how do we begin to change the narrative about what the etiology is into this behavior? How do we make sure that, for instance, those who work in education recognize that there are some people who deliberately get jobs in education context to sexually abuse children. That does happen. But actually the evidence that we have now in terms of what happens in terms of sexual abuse where teachers sexually abuse children is it's often much more situationally informed. A 23, 24-year-old recently qualified teacher who has a 14-year-old student who has a crush on them. And in that particular situation, that individual didn't have, if they suddenly realized actually, as a 24-year-old, I'm starting to have sexual feelings about this 14-year-old who has this crush on me. That's not an individual who had a pedophilic interest from an early stage. There's something quite situationally specific going on in all of that. But the difficulty that we have is that in situations like that, an individual will often then not have anyone else they can talk to about what they should do in that situation. And we also don't have actually a training of teachers that encourages teachers to begin to think about what they would do in that kind of situation. In the same way that actually a lot of the people who are involved with online sexual offending, in terms of who we see in StopItNow UK, have often started moving from mainstream legal pornography to more extreme material because they're desensitized by that material over time. So there are pathways that into this behavior that I think we can explain in public settings that might help people move away from an othering of sex offenders and begin to recognize actually these things that we sometimes describe as deviant sexual interests can have quite understandable kind of contexts and backgrounds.
And I think for me, the word choice is an important part of the conversation. It's something more and more I'm coming to appreciate, that a good amount of the public intentionally utilizes, and maybe unintentional as well, words that does further this othering of the victims, of the offenders, of the issue, and distancing of it. And I think helping to facilitate those conversations by elevating the script itself, by offering the different stakeholders in this space ways to have the conversation, examples of how to have the conversation, is an important step. One of the research projects that we did a couple years ago now, actually by one of our colleagues here was working on it at the time, Leah, was to understand the issue of sextortion and asking survivors of sextortion cases what their experiences were. And we learned that the biggest hurdle for them in disclosing, very few disclosed, but was the shame that was associated with it, whether it was disclosing to friends or family members. And some of that just came in terms of when we got to the campaign side, we needed to focus on how to have the conversation, not in saying, don't take the picture. The picture has already been taken. It's already been shared. But now how do we protect those kids and how do we help them on the path to recovery? And it was through facilitating the conversation for them and helping to equip caregivers and educators and all of the different stakeholders with ultimately a script, a language to use to start the conversation going.
And if I could just add one more comment.
Sure.
One of the messages that I use when I talk to the general public or when I give presentations is that we all want to protect children, right? We want to protect children from experiencing harm, but we also should want to protect our children from engaging in harmful behavior, right? And so recognizing that protection covers sort of multiple levels there. And all children deserve protection, those who are experience harm and also those who are engaging in harmful behavior as well. Yeah. And I think that has connected with audiences. No one's yelled at me, at least, so in response.
People yell at Ryan all the time.
They
Just
do.
not for that.
Yeah.
But it's a good point just to say, I think actually talking about adolescence and adolescent harmful sexual behavior is a way in, because people kind of get
Yeah.
that
Right.
and kind of recognize actually, yeah, adolescents do make mistakes and they have a capacity to move on from that.
Yeah.
But I would just say, I think we are, as a public, still not very well prepared to help all kids. And so, and there's a real need for these self-help and online resources that are targeted towards young people, and also towards their friends and family and professionals in their lives. And if I can just share a brief story, about 3 weeks ago, a young person reached out to me, a 16-year-old who's in high school, and he had disclosed to his guidance counselor that he had sexual interest in young children between the ages of 3 and 7. And he disclosed that because he just wanted some support, and he got kicked out of school. And that was the support. And then he got put into a behaviorally disordered student school where he was kept in a single room. He wasn't allowed to interact with his high school classmates because the administration was so afraid of him. They just didn't know what to do. So he managed to find me and get me invited to an IEP meeting by phone. And at the end of that, they were willing to let him go to 2 classes with his peers, but then he had to still stay in the room. And until they could get a one-on-one supervisor to go with him around the hallway, because they just figured if you're sexually attracted to young children, you must be at risk of any single moment reaching out and grabbing a child. So that's where I think these kinds of interventions that all of you are developing, or all of us are developing, we have a little ways to go before we're really truly reacting with the empathy and evidence that Kenny mentioned earlier. All right, back to you guys. So some of the things that you just brought up, Stuart, it brings this question to mind. Is every child sexual abuser a pedophile?
No.
Would you like to elaborate?
In the same way that not all adults who commit sexual offences are pedophiles either. We know that there are lots of different developmental pathways into sexually abusive behaviour displayed by children and young people. If you look at probably the biggest meta-analysis that we have looking at this, it's Cito and Lulumiere from 2010, which if you don't know that study and you're interested in this area, then you should know that study because it's a terrifically helpful work. And it was a meta-analysis that compared those studies that look at individuals who are involved with non-sexual offending behavior in adolescents who come to the attention of law enforcement, and those who are involved with sexual offending behavior. So really big data sets. And what they found was a real kind of diversity of kids within the group that committed sexual offences. Atypical sexual interest was one of the stronger factors within the sex offending group. And that included a sexual interest in children. But the definition of atypical sexual interest was actually really quite wide. So it included what was described as developmentally abnormal use of online pornography as well. I don't know what developmentally normal use of pornography is for adolescents, but there are certainly, some young people who are making mistakes because they're learning about sexual things from what they're seeing in terms of adult pornography, which is a terrible way of learning about what relationships and consent and what your body is and what other people's bodies are like. It's a terrible way of learning about things. That study also told us that if you were in the sex offending group in that study, you were 6 times more likely to have been sexually abused yourself. That's not to say that all young people who display sexually abusive behaviors have been sexually abused, but it is significantly overrepresented within that group. So there are various things that can help us understand why young people get into sexual trouble. And the stuff around kind of sexual interest with younger children, kind of paraphilias and that kind of area, it's certainly a factor, but it's only one of the factors that that seems to be there in the kind of pathways of many young people that we work with.
And I think in the general public and in the media, we have a tendency to sort of use pedophile and child molester interchangeably, but it's really important to be specific in our language, right? Pedophilia refers to its clinical diagnosis. It refers to an attraction. Molestation or abuse is a behavior. And so one of the things that we feature in Help Wanted, I didn't show today, is explaining to our users the difference, that there's a difference between attraction and behavior.
Nothing to add. I think Ryan
Okay.
absolutely hit exactly what I was thinking.
Great. Let's see. One question that came up that I feel is pretty relevant is, are there any Spanish, and I would add to that, other language resources? The question is specific to all three of you, actually, that you know, what are we doing to expand the reach of these interventions? And I'll just characterize this give you a little bit of context. That's a question from the audience, but we're here in the Johns Hopkins Bloomberg School of Public Health, which does a lot of global public health research. But most prevention research and interventions are developed in high-income countries. And so how do we expand the reach, both within our countries to other cultures and languages and beyond the limits of the high-income borders? Melissa, do you want to?
Yeah, actually, the sextortion campaign that I mentioned a few minutes ago, that started as a domestic initiative, the research and then the subsequent awareness campaign that came from it. The research itself, we partnered with Facebook on to conduct and to build that campaign out. And then we were able to continue partnering with Facebook to bring that campaign to a few international locations as well. That campaign is now operational in Brazil and in Mexico. And in order for that to happen, it was adopted by local NGOs that were able to adopt the messaging through a culturally appropriate lens that was relevant for their region, as well as to translate all the resources. So now those two have gone live. We quickly learned how much work went into the process of internationalizing a campaign, and from a sheer perspective of resources, we aren't able to go and stand that up in every interested country, but ISPs such as Facebook are looking at ways to have global facing pages around child sexual abuse attractions and the harms in looking at the content. So I know that their safety centers are exploring ways to elevate resources, have them translated into local dialects, and have them available globally. And I think that's one example of a campaign, but just in speaking with the panelists here last night at dinner, we're actively collaborating with partners in the UK, in Germany, in New Zealand, about some different prevention initiatives, both in terms of what is locally relevant and applicable, but also if there are learnings that we can share across programs, which might not be immediately accessible to us through local means. For example, Germany, the Dunkelfeld Project, because of the different reporting laws there, have a wealth of information that we would never be able to locally cultivate. Similarly, New Zealand is exploring new prevention efforts because they fall somewhere in between the spectrum of mandatory reporting that we have locally versus the opposite end in Germany, and to see how they can track impact of prevention efforts. So, both things. We need to be reaching those other regions, but partnerships is a critical way of doing it, so we aren't duplicating efforts.
This gives me a great opportunity to plug the Eradicating Child Sexual Abuse Project, which is very generously funded by the Oak Foundation, but it's facilitated by the Lucy Faithfull Foundation. The Eradicating Child Sexual Abuse Project, EXA, is a website that was set up about 3 or 4 years ago, which has around, I think, 160 different interventions that are being used internationally in different countries around child sexual abuse prevention. Some of those are around primary prevention. How do we get messaging out to the public generally? Some of them about secondary prevention, what kind of interventions you would have in particularly risky situations or with groups where there perhaps are kind of risks of sexual abuse developing, and tertiary prevention, what do we do after sexual abuse has been disclosed. The different programs obviously look at different target groups as well. Some of them are about children, some of them are about adults, some of them are about families, some of them are about situations. Because there are some kind of situations or some kind of contexts that are more risky than others. So there's a range of different programs there, and there's also a methodology on the website, which is a public health methodology, encouraging people within communities to begin to think about what data do you have about the issues around sexual abuse, and actually what kind of things are working at the moment in terms of the particular problems you have, but what are some of the gaps using a public health model that you may have, and looking at the information about the different interventions that are on the website. Are there things that might help you in some way? We're at the moment road testing that kind of strategic approach to child sexual abuse prevention that's proposed on that website in a couple of different test sites, one of which is in Bulgaria and the other one is in Brazil. And the idea is with a refresh of that resource over the next few months, and I'm very grateful that Elizabeth has agreed to kind of help us with this. We're intending to try and look at some of those issues around kind of culture within all of this resource as well. Because indeed, what sexual abuse might mean in one country might be very different in terms of what it means in another country. So it's that thing about not making assumptions here, but trying to make this website a way where practitioners can come together and begin to have conversations about prevention. What's working in one area and what might be transferable to another, but what might not be transferable for various reasons as well. And how do we begin to connect that to evaluation and measuring impact, and having some kind of general agreement about what we mean by measuring impact when it comes to prevention. So it's a resource that's been around for a while, but I think it's kind of indicative of lots of things that are out there. And one of the things that I've found over the last year or so managing this project is there's some amazing work taking place in France, taking place in Latin America. There's some extraordinary stuff going on in Chile in terms of prevention at the moment. There are just these wonderful kind of movements that are starting to develop. And I think we need to be better at kind of engaging those forces internationally and seeing how we can work together.
Yeah, this is absolutely a conversation we've been having about, about Help Wanted. Thinking about our phase 1 qualitative study, we had participants from countries in North America, South America, Europe, and then in Australia as well. And so we envision Help Wanted as a global resource. And so our plan is once we evaluate its effectiveness, that we know it's an effective intervention, then we would pursue not only translating the website, but also making it culturally competent as well. So that is in the Help Wanted plan.
Great. Thanks. Okay, I think we have time for just one last question, and this one might be kind of a doozy. If you can't take a risk here. This comes from the audience, so I'm distancing myself. I picked this on purpose because I think it is an important question. Some argue that online fictional materials that depict not real children, and I think maybe in this day and age we could also include the idea of sex bots, might serve as a resource for some individuals to get sexual release without hurting children. I have a very strong stand on that myself, but I'm going to hold off until I have you all weigh in on that idea. Nobody wants to go first.
Everyone take first at that.
Would you
Okay.
like?
Yes.
Would you like me to go first, or would you like to go first?
I would like you to go first.
I'm a clinical psychologist by training, and I think it is helpful, as I think we've heard today, to be open-minded about what can help people live a safe life. That said, I don't see an easy pathway towards providing images that still reinforce sex with children, even if they are not real children. And so I would not ever be comfortable with having my work be associated with anything that suggested that there's any context in which this is appropriate behavior.
Yeah, I sort of react to the potential messaging of that. This is a debate in the field, and scholars are debating this very question. And we don't have, for obvious reasons, a strong science base, right. I think, or at least for me to feel comfortable. And so I do worry about potential messaging and things like that. Yeah, that's a tough question.
Well, one of the people that we interviewed as part of our work, not part of the 30 subject qualitative study that we did, but one of the many people that were put in touch with by Luke Malone, one of our colleagues who's a journalist who spoke to over 100 young people with sexual interest in children, said something to me that really resonated. He said, for me, being around children keeps them real and makes me less likely to offend, because I can't distance myself from the harm that it would cause them. That this actually runs a little counter to the findings that you got, Stuart, from asking people who had already offended, would it help to know how much harm it caused a child? And they said no. But I think for people who haven't already offended, the answer may be very different. And it may be actually, the more real that kids are to me, the less likely I am to harm, because I don't want to hurt a child. And I would worry perhaps about the possibility of even non-real images or models of children serving to distance people from the reality of child sexual abuse.
I think there's something worth unpacking in all of that as well, because I think when guys were saying in our survey that they knew these were real images of children, and that wouldn't have encouraged them to desist, it's quite interesting kind of working with guys post-arrest who will say that actually one of the things that they increasingly understand is they make connections between the images that they looked at and children that are in their lives. So being reminded that there were real children perhaps might not have had an impact, but reminding them that they have children in their lives, and these children in their lives are similar to the children in those images, might have actually had some kind of impact. So there were kind of subtleties in all of this. I don't know if I have much to add to what you've said of answering this question, Elizabeth. The only thing I would say, because I think it also kind of relates to some of these debates about kind of child sex dolls as well, which we kind of link to this. I also generally feel that this thing about kind of fictionalized and kind of animated depictions of children in sexual ways are probably going to be unhelpful. But I think, as you've already mentioned, Ryan, the difficulty is we have so little evidence and so little research in this area, which is why I'm being really cautious in answering. And I suspect for some individuals, some of these things might be helpful in some contexts, but we just don't know enough about that. And I think there is something about actually us trying to proactively research this in some way. I'm not sure how you ethically do that. There are all kinds of challenges there, but it is a question that keeps on coming up, for instance, in debates within minor attracted person communities, what the role of fantasy is, and how proactive people should be in seeking out things that supplement those fantasies, and where the law sits in all of this. So we can't avoid this question. It's an important question, but we have no empirical data to sit next to it at the moment.
And I think from a public-facing conversation about use of those tools, at the end of the day, I have not seen any conversations that are able to give weight to the context. As Stuart said, it's a black or white from that dialogue standpoint, and particularly given the lack of science behind it, I have not seen that conversation start to be really productive because there hasn't been room so far to really dive into the context of it and the nuance of it. And I think that's really, we just don't have the data for it. So.
Can we thank our panelists for bringing their expertise?
Yeah. People in the journalists to do
So that brings us almost to the end of our symposium. Please bear with me for just one more bit of housekeeping and some final comments. First, the housekeeping. Again, each of you has a survey in your folder or online to complete. We are scientists here, and we take these things seriously. Please take the 2 or 3 minutes that's needed to complete the surveys. They tell us what worked, what needs work, and what went missing. And we review them closely and often do make changes based on your suggestions. So please complete the survey, and thank you for that. And I just want to close with a couple of thoughts. People often ask me how I do the work that I do. I get this question a lot, and I know that many of you do. Many of you mentioned it in your talks, and I know the rest of you in the audience do as well. People who are not in our field assume that it takes a terrible toll to directly face and focus on child sexual abuse, and it can, as we heard, take a toll. But people who are not in this field don't know what you and I know, that the very best people are drawn to this field. This annual symposium gives me the opportunity to do, what I love most, which is to gather with like-minded individuals who know that child sexual abuse is a preventable, not an inevitable, public health problem, and to work to achieve that prevention. Each year we come together to renew old friendships and to develop new ones. I could not be happier anywhere else than here, doing anything else but this. I especially want to acknowledge the Moore Center team and our partners at the School of Public Health for helping to put on this marvelous event. And if we could give those folks a round of applause. Thank you, Amanda. And everyone. Thank you. As I mentioned at the beginning of the day, we don't have enough federal funding. We spend far too little on prevention. We need to change this, and we will change this. Until we do, our work at the Moore Center is possible only through generous private philanthropy. We're grateful to many of you for your donations to our work. Steve and Julia Moore launched this center in 2012 and have kept us going now for more than 7 years with their transformative patronage. And I'd like to invite them up to say a few words.
Thank you, Elizabeth. We don't have any prepared comments today. In prior years, we used to read stuff, but it got to be too hard, frankly, so we thought we would just speak from the heart and say thank you. I want to say, first of all, it's strange to see your name everywhere, right? I mean, it's strange to hear your name all day long. And then to go, wow, it's attached to such a tough issue, the Moore Center for Child Sexual Abuse. To hear it all in one phrase is always a little bit, frankly, it's a little off-putting, right? And I want to just mention why we named the center. And we put this in the website. And the reason we're here is because my grandfather was a pedophile. My grandfather was a pedophile, and he hurt a lot of people in that process. And so we wanted to come back and talk about the various people who were impacted. My grandfather's last name was Moore, right? He harmed my family, and their last name is Moore. And so we wanted to try to capture in one name the complexity of this issue. And we wanted to get away from the shame that accompanies this issue, that people won't put their name on it because it's embarrassing. One time at this very conference, we had one of the Paterno family. And over the lunchtime when we were upstairs, he came and he said, "We didn't choose this topic." He was a great big football player. And I said, Joe, we didn't choose it either. Nobody chooses this topic, right? This topic chooses you. And now you can choose to do something about it, or you cannot. And so here we are. So we appreciate 8 years we've been attending, and we are always impressed to see the work that's done, the dedication of the people who are spending their careers really devoted to really trying to better understand and create solutions that will better protect children. I'm very touched to be a part and very proud, frankly, to be a part of such a wonderful group of people who really dedicate their lives to helping. So I'm sorry. With that said, Julia, I don't know if you...
Thank you all for coming so much. Now, go out, tell your friends.
Right.
Let's do more good work.
That's my question. And I'll leave it with that and saying we're grateful that each of you is here. But my question is, where's everybody else? And the question I have about this topic that I've never understood is, if 1 in 4 women and 1 in how many men?
13.
Where is everybody? And I'm very grateful that each of you is here, but where are the rest of us? Not just people whose families have been directly impacted per se, but where are the rest of the people who should be working with us to help mitigate this? And how do we get them involved, whether it's storytelling, how do we engage them in a topic where we could have such an impact and make such an improvement in the lives of so many people? But thank you for attending today. And thank you, Elizabeth, for all the work you're doing.
Thanks. And now we really are at the end of the symposium. Thank you for your attendance. I sincerely hope we see you back again next year. Goodbye and safe travels.